All right, implement. So an example here would be, which technique best reduces pain during a client's dressing change?
Give them med before you do the dressing change.
How far before would you give a medicine?
30 minutes.
30 minutes, so it has time to work. What else can you do? How often do we do dressing changes on wounds? It's usually every shift or every day, right? So pain medicine might be okay, but what else can we do?
Just positioning?
Maybe positioning. What are some of the other things that we do to help relieve pain?
Massage.
You show me a nurse who's made time to do a massage and I will hand you a $5 bill. Right. It's a great technique, but we don't get to it often.
Maybe breathing technique.
So breathing techniques might be one thing to include.
Guided imagery.
Guided imagery might be one.
That's been a test question.
What about just distraction?
Oh, yeah.
How can you distract somebody when you're doing a wound change?
Put your favorite show on and talk to them.
A favorite show, a conversation, talk about kids, any of that kind of stuff. And that's the same kind of techniques we use with our young population too. Like you're giving them an injection, you're not going to be like, okay, watch the needle go in, right? You're like, so tell me what your favorite cartoon is. And oh, it's Mickey Mouse. And so it's the same. And so when they're getting a wound change every day or a couple of times a day, sometimes it's just good to plan some kind of a distraction for that period of time. My favorite example, I had a patient who had a huge wound, and it would take an hour to do all the dressing changes. And we realized that we both really loved, it was a goofy soap opera, Days of Our Lives. We wanted to watch Days of Our Lives together. And so we just always scheduled the dressing change for 2 o'clock in the afternoon so that we could hang out together and talk about all the goofy things that Marlena and John were doing for the day, right? And so it minimized how much pain medicine I had to give her, and it made the time go faster for both of us. You know, we can't count ourselves out. That's pretty laborious. And it was a good way for her to not worry about it, and actually a way for both of us to be able to look forward to it too, which is kind of a nice bonus. Which intervention best decreases intracranial pressure?
Positioning the head of the bed.
What kind of position do you want the head of the bed at?
Is it above 30 or 45?
What do you think? Where you want the head of the bed?
How'd you can get it?
No, we want it less. I think it's less than 30 degrees.
Decreases in current pressure. Yeah.
You want to decrease intracranial pressure by about 15 to 30 degrees with the head of the bed. 45 if you really have to, 90 if they're eating, but otherwise you want them about 15 to 30. Why do you think having them 90 degrees would make a difference? Why would that make their pressure go up? Because it seems counterintuitive, right?
Because you're squishing your abdomen.
Because you're causing increased interthoracic pressure and you're compressing the femoral arteries, so the blood flow is not going back and forth the way it normally would, and all of that's going to cause increased pressure going up. What besides positioning? Do you want them to cough?
No.
Okay, so if they've got a cough, let's give them something to suppress that maybe. Do you want them to take deep breaths often? It's a tricky one, isn't it? So if they're taking deep breaths without having a cough and fit, then we can still do that. But otherwise, we might want them to take semi-deep breaths versus the kind of deep breath where you're like, I want you to feel it down in the bottom of your lungs. Give me a good cough. Might back off of that a little. Do you want them to be constipated?
No.
We don't want anybody to be constipated, but why these folks in particular?
Straining.
Because we don't want them to have to strain, because straining does.
Increase that pressure.
It increases interthoracic pressure, which increases intracranial pressure. Never mind what straining does just like right here. Feel all your veins pop out, right? What other things decrease intracranial pressure? Decrease stimuli. Do you cluster care or scatter care?
Cluster.
Are you sure?
You scatter. You don't want to give them too much. It overwhelm them at one time.
So this is one of the only times when you minimally cluster. So you're not going to go in and do an hour's worth of interventions at one time. 15 minutes, sure, and then let them rest for an hour or two, and then do something different. Because all at once, they're not going to have time to recover. Towards the end of that hour, you'll start to notice that their speech becomes more impaired, for example. Even things as simple as having a visitor in the room for 10 minutes versus an hour. By the end of the hour where they've been trying to interact with somebody, their speech might be garbled, they might start to have other symptoms, they might start to have weakness where they had had weakness before, that kind of thing. What else? Mannitol? Okay, so they might be on mannitol, which does what?
That automatic pressure? Is it,
What's mannitol do?
it does something
Doesn't that help with
the fluid sucking osmotic.
It helps pull fluid off.
Yeah, I was wondering.
So out of all the things that we've talked about, which one would best decrease intracranial pressure?
Like the best or the first thing to do?
Two different questions.
I'll say the head of the
Yeah, positioning.
position would be
Because that's going to be kind of the more consistent thing to be able to do, right? Is to keep them in a good position, 15 to 30 degrees, head midline. That's going to be the one thing that kind of endures and helps. Now, if we add more things into the stem of the question, right, then that's going to make it different. All right, which intervention does the nurse implement immediately for the client with decerebrate posturing? Going to run around and chase your tail in circles and scream like the room's on fire. What do you do? Be brave, speak up.
Like safety, like put the rails up on the bed, like.
Okay, so they're posturing. We want to make sure that they're not going to fall out of the bed or anything like that.
Decrease stimuli, maybe?
We can decrease stimuli.
Give some drugs. Give drugs. I'm trying to think of what drug.
Okay, we might do little drugs for them. We might give them a little oxygen. What thing helps preserve brain?
Cool them.
Cooling. So when somebody starts to posture, it indicates what?
Dying.
Brain.
It means the brain's being affected. So one of the things that you'll see more and more is that we can cool people, and that can help. That can help save brain. Now, assuming that you can't do that, what are some of the simple things that you can do to keep them cool?
Blankets off of them.
Decrease the blankets, decrease the temperature in the room, maybe a cool rag here and there,
Ice packs.
maybe ice packs if that's something that they want to do. So anything that can cool them off without, even if you don't have a cooling blanket, that's going to be something that helps to preserve their brain a little bit. Now, it might not have the most positive outcome anyway, just because posturing is such a bad prognostic sign. But those are the things that you might do initially. And then you can do what? You've got them cooled off. What can you do now?
I'll call the physician.
Yeah, you got to let somebody know what's going on. Let them know what you've done. Let them know how the person looks, all that kind of jazz.